Very good evening, everyone. Welcome to today's live talk 2025 for the School of Alternative and Complementary Medicine. The journey of a chiropractor, could this be your future as well? So I'm Yi Kai, the Senior Lecturer of the Chiropractic Program at IME University, and I'm currently serving as a President of the Association of Chiropractic Malaysia. I'm deeply involved in advancing the chiropractic education, health policy, and professional development. I also have the privilege to serve in the member of the TNCM, or Traditional and Complementary Medicine Council, under the Ministry of Health. And I represent the Asia in the World Federation of Chiropractic as well. And my area of expertise include the professional identity, ethics, public health, and health education research. I'm pleased to be here today, and I look forward to sharing insight and learning together with you all. So while we waiting people to came in, wait a few more minutes, then we'll invite our first speaker. Let's have some housekeeping rule. So we have muted the microphone for all attendees. For questions and feedback, feel free to put into the Q&A panel. At the end of the session, we're going to go through the Q&A session that you have. And this live webinar will be recorded. Okay, our first speaker is Ms. Grace Shin-Jia-Yong, the Head of Department and Senior Lecturer of the Chiropractic Program at IMU University. With over 20 years of experience as a chiropractor, she has been instrumental in advancing the quality of clinical education in the chiropractic field. Her expertise span neuroanatomy, innovation in education, and ergonomics, and she also served as the value member of the school panel for the chiropractic program. Passionate about advancing clinical education and research, Ms. Grace continued to lead initiatives and projects that push the boundary of knowledge in her area of expertise. Please join us to welcome Ms. Grace on her presentation all about the chiropractic.
Hey, good evening, everyone. Welcome to the webinar, and then thank you for joining this the session. I'm going to talking about all about the chiropractic. Okay, so have you had any discomfort or the pain or the feel like weak and the weird feeling in your head and the neck and the back or any joint in your body? Chiropractors care about your concern. So before we take a look at what is a chiropractic and then what chiropractors do, let's crack some myth on chiropractic. So first question, chiropractors only crack backs? Answer is no. Cause chiropractor concern about the correct alignment between bones, especially the joint, not only the backbones. Okay, cause the chiropractors care about the correct alignment of the bones to secure the muscle balance and the proper nerve conduction and blood circulation. Okay, so moving on to the second myth. So do you need a medical degree before you can study chiropractic? Again, the answer is no, because the completion of the A level or the equivalent level of the completion of the foundation eligible to apply for our program. So in the next topic, the Ms. Cho Kit Yi, our program director, will explain about the program structure. When you see the program structure, you will see the junior year of this program consists of the similar modules in the medicine to educate our chiro students to be able to diagnose the certain condition and also the when and the where they need to refer their patient out for the specialist. Okay, moving to the next myth. Okay, so chiropractic is not evidence-based. Answer is no. The modules and then the all educational the resources in our program are based on the recent research and then all the scientifically proven the evidences. So our education is based on the evidences. The next myth will be chiropractic is the male dominant profession. Answer is no again, because the main the treatment the method which called as the manipulation by the chiropractor is the technique shows the need the less the power or the pressure with the speedy manner. So meaning that if the technique itself is the students no need to have the physical big body feel to deliver the technique. And in addition to that, we teach the different the types of the adjustment skill, the suitable for the different body side of the student and also their preference as well. And then lastly, also we have a specialized equipment and also the tables to utilize to deliver the special techniques as well. So with the assistance of those different equipment and table, so the students or the chiropractors do not need to have a big body the figure to deliver any treatment. The last myth, chiropractors and the physiotherapists do the same thing. Actually, the answer is no again. Chiropractors that has been educated to produce the diagnose. So again, if you take a look at our program structure, the junior year consists of the basic sciences, which is understanding of the human body. And then senior year consists of the modules to teach the clinical sciences, which is able to student to assess the patient's condition and also diagnose the patient's condition and plan the proper treatment for the patient. So the big difference between these two professions is chiropractors able to diagnose the condition instead of just focusing on the treatment. Okay, and then secondly, we also provide the focus on the holistic care. Meaning of the holistic care, we care not only about the structure, we also care about the overall well-being of our patient. So we consider the patient's lifestyle. What about their previous the illness? What about their family history? And what about the job-related matters, something like that. So we also provide the advices and then the modification of the lifestyle as a part of our treatment. So we actually care about not only again the structure itself, such as like a muscles and the joint, and then the nervous system, not only that part, we also care about the other part of the patient's well-being. So that's the big difference between those two professions. Now, let's move to find out what is the chiropractic. Okay, the term chiropractic itself means the done by hand. It's an ancient Greek term. Spinal manipulation, which is the major technique of the chiropractors, is already acknowledged by the father of the medicine, who is the Hippocrates, and also the ancient Greek physicians. Daniel David Palmer is the founder of the chiropractic. So that is started at the 1890-25. Okay, and then first, the Chiro School is started in the USA in Davenport, Iowa, 1897. So meaning that this chiropractic profession and education possess the long history of the practice and education. Now, let's take a look at the current status of the chiropractic in the world. As you see this picture, right? So this picture shows the countries and then the area of where the chiropractors are practicing and educated. So meaning that this profession is very fast growing profession worldwide. Especially, there is over 40 international jurisdiction, which is well regulated by the law in terms of the treating the patient, such as United States, United Kingdom, and also Australia, New Zealand, South Africa, Hong Kong, and Philippines, Thailand, also Malaysia as well. So this chiropractic treatment is considered as a conservative and cost-effective management for the musculoskeletal system, which is muscle, bones, and joint, and also the nerves as well. Now, let's move to the chiropractor's the role. Okay, so this video shows that our hand is the most sensitive structure, deliver the most sophisticated the job. So that's why the chiropractors utilize their hands to assess and also treat the patient. So tactile diagnosis and the spinal manipulation and adjustment is the major way of the assess and then to treat the patients by chiropractor. Now, let's find out the role of the chiropractor. So the chiropractors concerned with diagnose and then treat and also to prevent the mechanical disorders of the musculoskeletal system. So treating and then the assessing of the muscles and the joint and the bones of our body. And also, we always consider what could be the strategy to prevent the recurrence of the current issue. We also concern with any effects of this system to the function of the nervous system. So that's why the chiropractors also help you if you have a weird feeling, something like numbness and the tingling sensation changes in your body as well. And chiropractors also do the holistic care. As I mentioned earlier, chiro care is not only the treatment for the muscles and joint and then the nervous system as well. We concern the patient's lifestyle and job-related matters, previous disease, and the family history in terms of their health. Okay, so that's why we concern about all these aspects to provide the optimized, customized treatment plan for the patient, and also try to improve the prevention of the recurrence of the current issues. Lastly, we closely work with the other health professions to provide the comprehensive care for the patient. So we teach our students to find when and where for the patient's referral. And also, is there any room for the co-treatment with other healthcare professionals? So these are the brief explanation of the chiropractor's flow. Now, let's take a look at the more details about the chiropractor's do and don'ts. Okay, as I just mentioned earlier, we teach our students to assess the patient's condition, to produce the diagnosis based on the result of the assessment. And also we teach the student to the timing and the necessity of the referral to the specialist. And also we care about what should be the strategy to prevent the recurrence of the disease. To do so, we actually teach the student to deliver the manual adjustment. We also utilize the physiotherapy modalities, and we have some special modalities such as using the certain the equipment suitable for the certain patient have a certain conditions such as activators. And also we use specialized tables to provide the traction and then the decompression of the structures. And then also we have a specialized equipment to deliver the lighter the weightage of the adjustment as well. We also have a strategy for the rehabilitation to prevent of the recurrence of the certain disease and to minimize the damage to the structure. So the chiropractors do the non-invasive treatment, whereas chiropractors don't do the prescription of the medication, any surgery or the injection, any emergency cares. So those invasive treatment are the treatment which chiropractors don't do. Now, move to the next part. So this diagram shows the key disciplines in the chiropractic. As I briefly explained about the examples of the chiropractic treatment, we do the joint manipulation and the mobilization to improve the mobility of the joint and also the recover the correct alignment of the joint and then the bone as well. And we also treat the muscles as we're using the soft tissue therapy. And then we also have the other techniques to improve the treatment result by using the physiotherapy. And also the chiropractic care, again, is the holistic care. We provide some advices on the nutritional counseling and the ergonomic advices as well. So we also teach the student and educate the student about what could be the the best and then the necessary exercise to prevent the recurrence of the injury and improve the treatment result. We also have a specialized area such as like a pediatric patient and then the athletes and then the occupational chiropractic. Next picture shows this specialized area and the patient pool where the chiropractors also can practice. So this picture shows that chiropractor treat the pediatric patients with a specialized technique and also treat the pregnant woman as well. And then we have a sports chiropractic, which is a specialized to the targeting to the needs from the athletes. And also we have the special like a strategy to treat the geriatric patients as well. Okay, so this will be the end of my presentation on chiropractic and the chiropractors. Now let's move to the next topic on the chiropractic education and student life in IMU University. Dr. Wang.
Thank you, Miss Grace, for the wonderful sessions about the chiropractic. So I believe all the attendees feel free to put in your Q&A as you go have gone through Miss Grace's sessions. So feel free to put in the Q&A questions. So while you guys is putting in the Q&A questions, let me read a little bit background about our second speaker. So our second speaker is Ms. Chow Kit Yi, the program director and the lecturer of the chiropractic program at IMU University. Driven by the deep passion of chiropractic care, she is dedicated at advancing both education and clinical practice in the chiropractic field. Whether she's speaking on the future of chiropractic education, innovation in clinical technique, or the importance of musculoskeletal health, Ms. Chow brings a unique blend of academic expertise and hands-on clinical experience to every session she leads. Let's welcome Ms. Chow Kit Yi to talk about the program that IMU offer.
All right, thank you so much for the kind introduction. And hello, everyone. So it's such a pleasure to be here to share more about our program. So it is truly a one of its kind in Southeast Asia. And personally, I'm very proud to be part of it. Okay, so over the next few minutes, I'll take you through what makes our program unique, the exciting journey our students go through from the classrooms to clinic and incredible opportunities they have locally and also internationally. So first of all, our program is not just recognized locally, so it has very long international standing. So of course, WHO actually sets guidelines for our program, our education and safety. So it actually defines our program as a healthcare profession that focuses on spinal, musculoskeletal, and nervous system health. So representing us, we have WFC. So it's a short form for World Federation of Chiropractic. So they are actually an official partner of WHO since 1997. So it's quite some time, with over members over about 90 countries worldwide. So together with these organizations, it actually helped to ensure that our program and of course our profession is safe, evidence-based, and also very much integrated into our own healthcare systems worldwide. Okay, so even if, as you can see the picture on the left, it is an article. So you can see that WFC actually has attended our IMU University convocation in 2024. So we have a very strong affiliation with WFC. Okay, so in Malaysia, we have a TNCM Council. Okay, so this is where we fall under the TNCM Council. It's actually in the year of 2016 and operational since January 2017. So TNCM Council actually regulates all of the registered traditional and complementary medicine practices such as chiropractic, which is our program, traditional Chinese medicine, Malay traditional medicine, homeopathy, and so on. So we all fall under the same council. So this is actually chaired by the DG himself. So it actually determines the qualifications, the registered practitioners, and basically the enforcement has begun, right? So in 2024, all practitioners, including us, the chiropractors, have to be registered to practice in terms of the commitment to a safe and standardized TNCM. Okay, so without further ado, why should we study chiropractic in IMU University? Because, of course, we are the one and only university in Southeast Asia that offers a chiropractic degree program. So if you want to study chiropractic without going overseas, IMU is the place to go. Okay, on top of that, of course, our program is also accredited by CCEA, which means the education that you receive here actually meets the international standards. So the accreditation gives our graduates a better recognition and also mobility, which means they can even practice in countries where CCEA accreditation is accepted, such as like Australia, you want to practice in UK, and so on, you actually can. Just that you have to take their board exams, but this is across the board. Okay, so studying chiropractic at IMU means you get a very, very much unique opportunity, high quality training and qualification with global credibility. Okay, now let's delve into our program structure. Okay, so let's have a quick overview at how it is. So as you can see here, we actually have 10 semesters, okay, in total, because it's a 5-year program. So basically 1 year, we have 2 semesters. Okay, so as I know the fonts are very small, but you can definitely have a look at what modules we offer per semester in our brochures or even in our website. So in semester 1 to 4, okay, so this is where you actually build your foundation of knowledge, of science, and so on. So you will dive deep into anatomy, physiology, biomechanics. You learn about posture, range of motion, and how the human body works. Okay, so this stage is all about understanding the body inside and out, of course. And before you ever actually see a true patient, a real patient. Okay, and in semester 6 and 7, this is actually where the fun really begins, because you start to learn chiropractic adjusting techniques. Okay, so we have many different types of techniques and skills to actually teach you on how to perform adjustments, and of course palpation as well. And as you know, chiropractic is all about our hands. It's a very much hands-on skills that actually define chiropractic. So this is when the students often say they really start to feel like chiropractors. Okay, and then we have semester 8 to 10. Okay, so this is where you will actually see real patients. Okay, so you will be in our on-campus chiropractic center, treating actual patients under supervision. And this is where you apply everything you have learned, not just the technical skills, but also communication, patient management, and professional conduct in semester 8 to 10. Okay, so this is where you actually practice in the clinic. So by the time you graduate with the 5 years, right, you have already had years of practical experience with real patients, which makes you even more confident and clinic ready from day 1. Okay, so you'll be very much ready. Okay, then now I'm going to talk about, besides the program structure, we're going to talk about how our program is also strengthened by our strong professional partnerships, okay, such as, So we talk about partner universities first. So you can actually opt for a full local track, which is doing 5 years in IMU itself. Or if you're keen to actually have a credit transfer to our partner universities, so we have 4 options, okay? 2 in Australia and 2 in UK. So in Australia, we have CQU, Central Queensland University, in Brisbane, and also Macquarie University in Sydney. Okay, so you'll be doing 2 years here in Malaysia in IMU, and then 1 year degree in these 2 universities. Okay, and then the final 2 years of masters will be conducted there as well. So that's why it's called 2 + 3 years, and you get a master's of chiro. So now, besides partner universities, our program is also pretty much strengthened with our strong professional partnership. So we are connected and leading with organizations such as FIX, WFC, and CCEA. So FIX is actually a short form for the International Federation Sports Chiropractic. So it gives our students and staff access to global sports chiropractic networks, training opportunities to work with athletes at major sporting events such as Olympic and so on. Actually, recently, there was an event in Chengdu, China, and one of our alumni managed to be a huge part of it and participated in the Chengdu sports. And then we also have WFC, like I mentioned, so it is a worldwide body representing chiropractic profession. And annually they will have workshops and seminars, and chiropractors around the world will actually gather to attend their conferences. So it's very, very exciting. And then, of course, we have CCEA is our accrediting body, and it assures our program that meets rigorous international quality benchmarks that give our graduates recognition in many, many parts of the world. All right, so now we're going to talk about who do we have in our program. So now our program is not only as strong as it is, but the people delivering it as well is very strong. So we are proud to have a truly international team that blends academic excellence with clinical expertise. Okay, so our lecturers come from different countries and nationalities, wealth of global perspectives to your learning experience, as you can see our beautiful faces there. So within our team, we have chiropractors with over 30 years of clinical experience. We also have active researchers who are advancing the profession. We have like medical professionals such as doctors, radiologists, physiotherapists in our team, and which means that this diversity means you are not just learning from textbooks, okay? You're actually learning from us, the people who have lived and practiced in the real world of healthcare. So many of our lecturers are also actively involved in the organizations like WFC, FIX, and so on. So you get insights that are very current and internationally relevant as well. So they're not just teachers as well. Okay, we can be your mentors. So if you join our program, we actually have this mentor-mentee program. So we will actually guide you from the classroom to the clinic. It makes basically making sure you graduate confident, competent, and ready to serve patients anywhere in the world. Okay, so now we're going to move on to resources. Okay, so basically, where are you going to learn? How's the classroom going to be like? So as you can see at the pictures over here, the picture on the left is actually all our chiropractic treatment based in our clinic. And you can see the red bench. That's actually what we call our chiropractic table. So this is how it looks like. Most of the time, we'll be using that to treat our patients and also to do your practices as well. Okay, and the picture on the right, okay, that is actually our medical museum. So one of the things that truly sets our program apart is the state-of-the-art resources that we actually provide to support our students' learning and clinical training. Okay, so in this medical museum, it's not just any medical museum. Okay, it's not your average anatomy lab because it's equipped with cutting-edge HoloLens, mixed reality technology. So imagine studying anatomy and being able to walk around a life-size 3D hologram of the human body. And then you can peel back layers by layers and you explore the structures from any angle. So this is actually very interactive and quite unforgettable. Okay, and then, yes, this is how it looks like for practical sessions. Okay, you can see our students having fun there. Yep. All right, and then we have our student intern clinics. So we have our own in-house chiropractic clinics. We actually have 2, okay? So this is where students gain real patient care experience under the supervision of the licensed chiropractors as a supervisor. So we have 2 locations, one in Bukit Jalil, okay, and another one in Serdia Walk. So students actually see a wide variety of cases and patient demographics. So these clinics are not just for training. We actually serve our community. It gives our students a strong sense of professional responsibility and the chance to actually apply their real life skills. Okay, now the fun part. Okay, yeah. So a little bit more about community service. Okay. So it's not just our program is not just about lectures or labs or practicals, blah, blah, blah. It's also about the experiences that actually shape you into a well-rounded chiropractor. That's what we believe. So we are not just learning from the classroom, okay, because our students are very active and visible in the community. So as you can see, all of the pictures here, okay, they participate in numerous health screening events, at least once I would say every 2 months, okay? So they engage directly with the public, they do spinal screening, they do promote a lot of spinal health, they do ergonomics, they do some competitions, so it's very, very much quite fun for both the faculty and the students. And you can see here, so student mobility program, okay? So one of the great strengths of our program is mobility and global exposure. Because we are internationally accredited, so our students have opportunities to actually connect and collaborate with chiropractic students from all around the world. And recently, we even hosted students all at once from Teesside University in UK, Murdoch University in Australia, and even CQU as well. So these exchanges allow our students to share knowledge. They can compare techniques, and then they can actually build the connection as well. Okay. So exposure not only broadens the skills, but actually gives our graduates the confidence to work in a very diverse healthcare settings. Okay, whether it's in Malaysia or anywhere in the world. Okay, so you can see the pictures around here. Okay, so this is both inbound and even outbound. Okay, so our students also have the opportunity to travel to those countries like UK and Australia to do their mobility program. Okay, now interprofessional learning. Okay, so as you can see, okay, so on campus itself, because as you know, our university have a lot of different programs. We have like School of Medicine, we have School of Dentistry, School of Pharmacy, School of Biomedical Sciences. We have just so many different types of programs and schools available in our university. So on campus, the good thing about this is we actually work very closely with other faculties and other students as well. Just like dentistry and biomedical science for interprofessional learning. So this actually helps to mirror what a real-world healthcare teamwork. So because we are all about One Health. Yes. Okay, so some cute pictures here. Okay, so we also celebrate our student lifestyle. So Pyro Night, as you can see here, so we have live performances by the students itself, and then we also have Chiro Cup sports tournament. We also have our alumni and networking day, as you can see in these beautiful pictures. So this is where it can connect the students with the career opportunities, and of course, last but not least, we have, of course, we have student poster day for our research as well. Okay, and of course, we also have our World Spine Day. So this is conducted annually. So our students also shine on the global stage because every year they actively participate in World Spine Day activities. It promotes their spinal health awareness in the community. And we are proud to say that IMU Chiro has been recognized as a winner for many, many consecutive years, as you can see here in the picture here. So this is a testament to our students' creativity, dedication, and also the passion for the profession. Okay, and last but not least, and our students are not just active, okay, they have been achieving on the world stage. So recently, our students actually were awarded a prestigious research prize by WFC. So it proves that our program develops not only skilled clinicians, but also future leaders and innovators in chiropractic. Basically, I just want to wrap up is here, you won't just study chiropractic, you live it, you breathe it, and basically you share it with the communities both near and far. Thank you.
Thanks, Kiki, for the wonderful explanation about the program. And I see questions is coming in, and feel free to type in more questions So we have go through about chiropractic, we have go through about the program. More questions is coming in, so feel free to type in your questions. So after the session, we're going to go through the Q&A. So next part will be covered by me. So I'm Yikai again. So I'll bring you through the career path. So once you graduate, what do you do and all those as well? Let's start. So once you graduate from IMU Chiropractic degree, you can go out to practice. So either in Malaysia or overseas. So if you are practicing in Malaysia, as mentioned earlier, it's a regulated profession. You need to register with the Traditional and Complementary Council under the Ministry of Health. Okay, so if you want to go overseas, then you need to see what are the requirements that need to fulfilled by the country. So like I mentioned previously as well, we have alumni practicing in Australia, New Zealand, UK, and all those as well. So they are practicing over there. So with that, they need to fulfill the requirements. We have quite a number of students in Singapore as well, Hong Kong, and all those things. So beside the degree that they got from IMU, they need to fulfill the requirement of that country, the competency requirements, and all those as well. So in terms beside practicing, graduating practice, they also can go for specialties training as well. So for specialties training, there's a two pathway. One is more academic pathway, like taking their master of science, PhD, and all those as well. Or they want to go into the specialties training. So I believe some of you might be interested in sports. So like Kiki mentioned that some of our alumni actually go to Olympic, go to World Game, and they have specialties and interest in sports. We also have quite a number of pediatrics as well, means treating children, baby, pregnancy, and all those as well. We also have alumni that actually go into radiology. So there's actually a very bright and also branch that you can go into after you graduate from our chiropractic program as well. So a little bit about graduate employability. So people say, hey, yeah, you mentioned you can go out, you can go Malaysia, you can go overseas, but what is the proof, the employability? So over here, you can see over the 2020 until 23, we can see that for IMU graduate, for chiropractic in particular, this statistic, once they graduate, they actually within a year they will get their job. So about 90% plus they are getting the job. And actually some of graduate, even before they graduate during their final year, they already received the job offer as well. So it's actually very well received as well in terms of the employability. So no worries about not getting job. It depends on whether you want the job or not. Yeah. So also very good indication like report cards for us as well that actually it was actually recognized under the Talent Bank National Graduate Employability Index, and chiropractic is actually named as one of them at the employer choice as well. So when employer want to hire chiropractors, and we are actually one of the top choice they will choose, and this actually show the employability of the chiropractic graduates from IMU. Okay, so here's some of the testimonial from our alumni. So you can see it on our website as well. Some of our alumni actually go through the program, they actually give feedback and how their experience and all those as well. So we have alumni that go through the local program, credit transfer program, and all those as well. Okay, so this concludes the three sessions that we have. So now we have game sessions, like a Kahoot sessions. So you can take out your phone and scan the QR code. Okay. So in terms of this, we actually will go through a few questions that actually summarize what we have been talking for the past three topic area. So to make sure that you have learned and also understand what we have presented as well. Okay, so we give a few seconds, make sure everyone are able to scan the QR code. Okay, so able to scan using camera. So you're able to go to a screen that actually game. So you can register your name. So we are pulling up the Kahoot registration. So we go through the fun part now, the game sessions. Okay, so just now we send the QR. So there's a QR here. So feel free to scan. So don't be shy. So this is actually good to see later the excitement that go through while you're answering and those as well. Let's start. Okay, so we'll go through some questions now. Okay, chiropractic refer patient to other healthcare professional when Wow. Okay. So good. So it's case beyond chiropractic scope. Okay. So let's go to the next one. Okay, no worries. Okay, so what does the term chiropractic mean? So do you pay attention to what Grace has mentioned? Okay. Good one. That's 4. Yes, chiropractic means done by hand. Next questions. Wow, Satu Malaysia. Good. Okay. What is chiropractic primary concern with? Okay, so what do we do as a chiropractor? Okay. So everyone, did you choose the longest answer is the right answer? Or do you really listen when they presented just now? Okay, let's go to the next one. Oh, Daniel is coming up. Okay. Okay. Which act does the chiropractic is recognized under in Malaysia? Is it the Medical Act, the Traditional and Complementary Medicine Act, the Chiropractic Regulation Act? Oh, wow, everyone get it correct. Congrats. So I think you will score well in the regulations when you start your chiropractic degree program. Okay. So when this chiropractic program is first introduced in IMU? Did 5, 10, 12, or 16? 2010. Yeah. Okay. Yes. So this is the scoreboard. Okay. It's the last questions, I believe. Yes, the Council on Chiropractic Education, Australasia. Okay. Yes, congratulations. Okay, Agro. Okay, you scored 3,747. So the top 3, okay, I believe you are listening well during our sessions. Okay, so hopefully you're having fun with this. Okay, so let's convert back to the slides. Let's have some Q&A now before we proceed. So let's invite back our 2 speakers, which is Grace and also Kit. Okay. So there's actually quite a number of questions. So let me go through and I'll direct the questions to our panel here. So the first question that I received is, I'm taking this chiropractic course and I'm doing a transfer program. Does RMIT do not offer chiropractic anymore?
Okay.
Yeah.
Yes, I guess I can answer that because I actually graduated from RMIT. Sadly, RMIT does not offer chiropractic program anymore. But the good news is our partner universities, we got 2 from Australia. So we have CQU in Queensland, and also we have Macquarie from Sydney. So you actually have these 2 choices to do a credit transfer. I hope that answers your question.
Okay, I believe it's good answer. So okay, so let's go to the next one. I want to know the advantage of getting the degree from the university overseas. Can I work overseas after I graduate with this degree? So I think there's 2 questions here. One is the the degree from Malaysia and overseas, and what is the things I can work if overseas or not. Okay, so maybe first question we pass to Kit about the degree.
Yep. Okay, so in terms of advantages of getting a degree from the universities overseas or in Malaysia, so if you do your studies, if you do a credit transfer to, like, let's say UK or Australia, you will actually have a master's included, so for within the 5 years. But in Malaysia, you will have a bachelor of chiropractic. So that will be the differences in terms of advantages if you want to do a credit transfer to our partner universities in UK and Australia. But I guess it really depends on where you would like to practice, because if you want to practice in Malaysia, it's good enough to actually have a bachelor of chiropractic.
Yeah, I think it's very right. So what happened is, regardless, it's overseas university or Malaysia university, is where you want to practice at the end. So if you want to practice Malaysia, if you get overseas, you still need to fulfill the local requirement. So if you graduate with local or overseas, if you want to work another country, then you need to see what are the competency requirement on those as well.
Yeah.
So it's very depends on your future that you want to go into and all those as well. Let's next questions. I'm concerned if there's a career in Malaysia for this profession. Maybe I pass to Grace about the professions.
Okay, so profession in Malaysia, as I mentioned earlier, so chiropractors are treating the musculoskeletal and nervous the issues for the patients in Malaysia. So I think the have a quite a broad spectrum in terms of the treatment the scope, right? So that's why usually our student after they graduate they practice on the private clinic. And also the Dr. Kid, as mentioned earlier, they also can choose the career path in overseas because our program is accredited by the CCEA. So meaning that our students are eligible to sit for the national board exam to get the license to practice overseas. So I think for my student, I usually advise to start the practice in Malaysia to actually get the more experience because I found that we have quite a good pool of the patient in Malaysia into student internship clinic, so they can experience quite a lot from it. It's still okay to practice in Malaysia before they consider the like job opportunities.
So it's not no need to concern too much. I mentioned by Grace as well. So you can choose local or overseas. So as I mentioned as well, some of our graduates actually get job offer even before they graduate. And in IME, we have something called graduate training program as well. So that's actually link our student with our the partners as well, the industry as well. So hopefully that answer the questions. So let's go to the next one. So next one is, would like to ask, other than musculoskeletal issues, any other kind of disease chiropractic can help? So maybe Grace, you want to answer this?
Yes. The chiropractors, yes, focus on the muscles and the joint problem and then alignment of the correct alignment of the joint. But we also treat the issues like a headache, the migraines, and the sciatica, which is the issues related to the nervous system as well. So and also on top of it, because we provide the holistic care, so we check our the patient's lifestyle. We also can advise about the stress, the management and also the diet as well. So if they have digestive system issue that we can actually address and provide the advices based on their lifestyle and then the diet habit as well. And also can provide the nutritional counseling as well based on their current diet as well, something like that. And also we provide like ergonomic advices as well. So that's why the job related, maybe the hobby related, something like that. So we try to find the root cause of the problem, not only the treating the symptoms. So that's why I keep emphasizing that our care is like a holistic care. We concern the every aspect of the patients, the current condition and the lifestyle to prevent the recurrence of the issue. Okay. So next question, I have another question, right?
Yeah. So it's a good one. So chiropractic not just treating about MSK, not neuromuscular and all those as well. So we do treat beyond, like Grace mentioned, we can do nutrition advice, and also when you go through our program, you will know that you learn all this. So we have faculty from our School of Medicine, School of Pharmacy, nutrition and dietetics. They actually we cross teaching as well. So it actually help you to learn as you go, to equip you to be competent as well. Okay, so the following question by the same is why will chiropractic accept as a mainstream medical team is like having chiropractic department in the hospital? Maybe I can pick this up a little bit in terms of the public health structure. So in Malaysia, because we have allopathic system and also the TNCM or traditional complementary medicine, due to a law restrictions, which is the Private Healthcare Facility and Service Act. So it actually prohibit the allopathic and traditional to be in one building, one entrance. So this is not to confuse the public when you walk in the door, you are to see allopathic or TNCM, traditional complementary. So because of the regulatory restriction, we are not in the same building. However, I believe that there will be opportunity. They have two entrants for allopathic and TNCM, all those as well. So we're looking forward. And in terms of the act, government is actually come out with the TNCM Healthcare Facility and Service Act as well that govern the facility component of TNCM. So they actually will bring up the profession as well. Okay, so let's go to the next one. Is outbound mobility program sponsored by the university? So good question. So in the university, we actually have, let me take this question. So I'm part of the mobility coordinator as well. So for outbound mobility program in IMU, it's actually we have a pool of fund. We call it Student Mobility Fund. So when students want to go outbound mobility, you can apply under this funding. There's some guideline how to apply, and also depends on the availability of the fund as well. So we do have funding for the outbound mobility for students to go. So for chiropractic program a little bit as well. So our students actually go out during semester 7, end of sem 7 and end of sem 8. So they actually can go to the partner schools or the community service in Philippines, all those as well, that they will go through to experience that kid has shown about the photos and all those as well. Okay, so we have another question. So this maybe can Kit and Grace can answer as well. So there's two parts as well. So for chiropractic, what is the difference between chiropractic and orthopedic, and what is chiropractic and physiotherapies? So I believe Grace can talk a little bit on the chiro and physio.
Okay, so again, the difference, let me compare between the chiropractic and orthopedic. Okay, so it's using the diagram in the slide. So big difference between the chiropractic orthopedic is the chiropractors provide the non-invasive treatment. So we don't do the surgery and the injection and the emergency care, whereas the orthopedic provide the invasive cares as well, along with the non-invasive care. But the difference between another difference between the chiropractic and the orthopedic is the chiropractors could be the care, the treatment could be another option when the orthopedic treatment is not working for the certain the patient. So because we have more like options in non-invasive way, so it's not really the less concern and the less risk about the intervention of the treatment, something like that. And the difference between the physiotherapy and the chiropractic again is the major keyword to explain difference between these two faculty is the able to diagnose. So we teach our students to be able to diagnose and then plan the treatment plan for the patient, whereas the physiotherapist majorly the focus on the treatment part only instead of diagnosing the plan the treatment.
So these three professions that actually have their own scope and also some overlapping here and there as well. Okay, next question is for Kit. Do students have internships?
Yes, the students definitely have internships. So as I went through the program structure, so we actually have internships in semester 8, 9, and 10. Okay, so you have this internship in our clinic. So we have Bukit Jalil and Sediawak Clinic. And also in semester 10, you will have the opportunity to actually work at some of our partner affiliation clinics. Basically, you will have placement at that part as well.
So next question is for Kit as well. So why that is 5 years at IMU graduate with a bachelor degree, but in transfer programs with a master with 5 years as well? What's the difference between this master and bachelor and all those?
Honestly, I don't think there's a very huge difference between a bachelor degree and a master's degree in terms of whether you can practice or not. Because actually both with Bachelor of Chiropractic from Malaysia, IMU Malaysia, and also Masters of Chiropractic from overseas, both also can practice. Actually, you can practice in Malaysia, you can practice in UK, you can practice in Australia. I guess the only difference is if you have a master's, if you do have a plan for your career pathway to be part of us, for example, as a faculty, then you could actually join us without going through another master's degree and so on. Yeah.
Yeah. So in terms of the degree wise, every degree, bachelor, master, or DC as well, or is recognized in Malaysia, then it's as a competent as an entry practicing degree requirement, because every country have their own system of education. So like US, UK, Malaysia, and those things. So that's why that's how the naming is different. But all is benchmarked as an international standard. Okay.
Yeah.
Next questions, also common questions that we get about the fresh grad pay and all those as well. So it's actually variance depends on what company you join, even local or international. So what happened is depends on the company you go in. If you just try to Google chiropractic salary in Malaysia, so you can get from JobStreet, Salary Expert, and a few other platforms as well. So they give you a range. So because of the market fluctuation, depends you're working for a small SME, a solo chiropractic, or big enterprise, that's actually very different. But in overall, it can either the compensation package, it can be a basic plus commission, or full commission. So it very depends on the company as well. So you just Google and see, you can see the range depends on the company structure and all those as well. Yeah. So next question. Nowadays, there are more and more chiropractic clinic in Malaysia, especially in KL. Will it be oversaturated? Maybe I pass to Grace for these industry questions.
Yeah. Actually, the different clinic has a different philosophy, meaning that the way they treat is a different. So even though it seems like there is like growing of the population to seek the chiropractic treatment, still I think okay to treat the patient in a not in a oversaturated way. Still, they're looking for the different options, even though they're seeking the chiro treatment, they also can find the different ways to treatment and then the approach to the patient's condition. I think it's still okay.
Maybe Grace, Keith, do you want to put some input on this question as well?
Yeah, I know that it seems like there's a lot of clinics that you know, when you drive across and then you see a chiro clinic here and then chiro clinic there. But I think based on statistics and all, actually, we do not have enough chiropractic clinics based on the population yet. Even in KL, actually. So like Johor, Penang, Malacca, those kind of places, actually, we do not have enough chiropractic clinics based on the population, actually.
Yeah, a very good question and input as well. So as a statistic point of view, like how a bit stats here. So in Malaysia, we have about 32 million populations. And as per the Ministry of Health registration, we have about 518 chiropractor registered. And in terms of Klang Valley, we have 8.8 million population and about 80% of chiropractor practicing. So if you do a math calculation, 32 million divided by 518. So there's still a lot ratio to do as well if you're going to compare to medical, dentistry, and all those as well. So one dentistry or one medical, how many are they serving? So same as chiropractor, one chiropractor, how many people are we serving? So we're looking at a ratio, there's still a workforce required in that sense as well. Okay. So next, this is a good question. So I'm an introvert. Am I suitable for this career? So, Keith, do you want to put input on these questions?
Okay. Yes, I do think whether you're introvert, extrovert, I think you can be suitable for this career. But of course, with chiropractic, we do deal with a lot of patients. So you have a lot of communication with the patients or even, you know, with your colleagues as well. It is good to actually work on the communication part. But to be honest, I was an introvert myself last time. But going through the chiropractic course, it actually puts me in the spotlight where I really have to deal with the patients. I really have to talk to the patients. So gradually you can improve, you know, and you have the faculty to help you with it. And you have a lot of exposure first before you actually, you know, see a real patient. So we actually emphasize a lot of communication with the patients. We have simulated patients as well for you to practice on, and you can also practice on with your, you know, with your friends and your classmates first. And we'll be there to support you and to guide you on how to communicate and, you know, yeah, basically to build rapport and so on. Yeah, so don't worry about that. Yeah.
Okay. Grace, any input for this or it's okay?
Yeah, about our practical sessions and the internship. So we assist our students to build up the teamwork and then the communication skills as well. We have a lot of practical sessions, always including the communication skill. So even I'm also the introverted person. Yeah. So but no problem to actually practice and then treat the patient. So we assist the student to build up this skill as well. Yeah.
Next question for Kate. Do I need to be a science student to study chiropractic?
In a way, yes. So we have some sort of entry requirements. So you can go through like foundation in science. So IMU also offer foundation in science where you actually go through that foundation for a year. And then if you meet the minimum requirements, you can actually join us our program.
Yeah.
Um,
So if you don't have a
subject.
science background, it'll be a bit challenging because we have
Yeah.
physics, biochem, and all those in our program as well. So tendency of failing is high if you are from a very weak science or non-science as well. Okay. So next question, for Grace, I think it was briefly mentioned, can chiropractic diagnose illness, meaning whether they can make an official diagnosis?
Okay, so we teach our students to be able to find the where we need to refer our patient to the specialist or not. We actually don't do diagnose for the all illnesses, but they will equip to actually to get an idea whether we need to refer this patient to the specialist for their further investigation and then confirming the diagnosis. So that's why we are kind of heavy on the basic sciences, including the physiology, pathology, microbiology as well. And then we have a lot of hours for practical sessions to discuss about the patient's cases, not only for the musculoskeletal system. So the student will be taught by on other like systemic illnesses as well, not only the musculoskeletal issues.
Okay, thank you. Due to time constraint, we're going to take one more questions. Okay, though this one maybe Grace can answer or Kate as well. Can we start work immediately after graduate, or do we have to serve any compulsory service? Maybe I can give a little input, then can add on as well. So as per the TNCM Act, there's require 1 year of housemanship, but due to the limited resources, there's no activated the housemanship yet. Then at the moment, you do not need at the moment.
I think Ika, you already pretty much covered that. Yes, technically after you graduate from our 5 years degree, you can actually start working whether you want to work in a private clinic or you want to start your own business. Yes, you can.
Yeah, so you can start a company, but to official practice, you need to get your license and all those stuff.
Yeah, of course. Yep.
Okay, so let's pull the slide back. So before we end the session, there's still a little bit information as well. Okay, so I will thank you for this evening for joining the session. So just for your information, we have an open day coming on this Sunday from 10 to 4 p.m. and do register to come. And because if you registered to join the program on open day, you get some waiver. So here's some of the highlights that you can get a registration fee waiver of 800 if you sign up on this Sunday. And also we have career education counseling, and there's also some scholarship and bursary and digital health preview there as well. And on top of that, we actually have a talk session as well. So that giving by one of our lecturer, which is Vivian, who also are alumni as well. So aligning your passions and purpose about the chiropractic career path as well. So do come and join us, especially this session if you're interested in chiropractic, 12:15 to 1:15, and see you at the IMU as well. Okay, so on top of that, before we end the session, there's actually we have a few live talk session that we have planned throughout this year as well. So if you have a look at our social media, like and follow so that you can know more about this session. Thank you.